Thanks so much, Emily, and a good morning to everybody. We really appreciate you joining us for this virtual access event. We've got a great panel lined up, and it's great to see so many registered for this morning's discussion. We've had great success in our region and state over the last 2 months in reducing the spread of coronavirus and in flattening that curve. And I recall in early March, as we were getting into this, thinking there's not a region in the country I'd rather live in if we're going to go through this than our region, because of the incredible leadership we have and expertise we have in our public health sector, both at the local and state level. And that has proven itself out as our public health leaders have worked so closely with the private sector to be smart and prudent about how we respond and socially distance and pay attention to the science and data to drive down that rate of infection. As we've done that, we've seen devastating impacts to our economy, to our unemployment rate. And today, more than 800,000 Washingtonians have filed for unemployment, and we've seen 33 million across the country. The economic impacts have been devastating to our downtown across all sectors, from arts and culture to restaurants, retail, hospitality. There's really not a sector of our economy that hasn't been affected. So as we continue to focus on flattening that curve and doing everything we can to keep people safe and healthy, we turn our attention now to how we reopen the economy, get people back on their feet, get our businesses and nonprofits reopened, bring our economy back here in our region and across our state, but do so safely and smartly. Nobody wants to return to the steps that we've had to take over the last 2 months. We don't want to have to repeat what we've gone through over the last several weeks. So we've put together a panel today to help us understand how we move forward, how we reopen our economy, how we do that safely. Patty Hayes is the Director of Public Health for Seattle and King County, the 9th largest public health department by population across the United States. She's had a distinguished career of more than 30 years in this sector and has served as a public servant for King County government for several decades. Thank you for joining us, Patty. Governor Gregoire is the CEO of Challenge Seattle, an entity made up of 17 of our region's CEOs of our region's largest companies, that's focused on keeping the Seattle area globally competitive and innovative. Of course, Governor Gregoire served 2 terms as Washington State's governor from 2005 to 2013 before taking on the role of CEO of Challenge Seattle, and 3 terms as our state's Attorney General. Appreciate you being here, Governor.
Thank you.
John Kelly is Executive Vice President of Public Affairs for Starbucks. Executive Vice President for both Public Affairs and Social Impact for Starbucks. John has a range of responsibilities in that role across all of Starbucks brands, their business units, and across their geographies around the world. John, appreciate you being here today as well.
Good morning.
We're going to jump right into it and start with Patty Hayes. And the health criteria and requirements really are the foundation of any successful reopening. And Patty, the State Department of Health and Dr. John Wiseman, the secretary there, over the last couple of weeks has laid out some of their criteria around testing, tracing, the availability of PPE, and sufficient space to quarantine those that are infected. Can you speak more to those criteria? Where do we stand today in advancing and scaling up in those areas? And then what is the responsibility of your office in deploying more testing, more contact tracing, et cetera, and meeting those objectives versus the role of our State Department of Health?
Well, thank you, John. And let me start by just being grateful for the opportunity to join you this morning and for DSA for bringing us together. Really appreciate the opportunity to speak. I want to start out by just really acknowledging the challenge that we're all in, unprecedented in all of our lifetimes. A pandemic was not something I expected in my career. And it's particularly challenging because the information we know about this virus we're learning as go. And every day, the scientists are giving us more information that increases our knowledge and that we're using as strategies. So that's real-time science in action for us all to know. And also, I really want to thank everyone on the call today and DSA for the leadership, the working that you each as individuals and communities have done has saved lives in our community. It's slowed the infections, prevented our hospitals from being overrun. I'm so grateful to all of you. I can't express that enough. I wish we had better tools, actually, John, for where we're at right now. And I'm going to speak to a couple of key points that the governor's emphasized. But let me say, first of all, the role of the health department in Seattle and King County is so key for the state. We're the metro state of Washington, and we often are the herald to the new policies, practices. We often pilot things, so we work dynamically on a daily basis with the state of Washington. John Weisman, who is a friend of mine and longtime colleague. So I would say Washington State is fortunate to have the largest metro and the state with great relations. I talk about my colleagues in other states, that's not always true, but let me assure you, we are learning things here in King County, we're shaping the statewide practices. The reality is that we'll likely need physical distancing for some time, and we have some emerging, what feels like effective treatments. Whether or not we get a vaccine in the next couple of years is very unknown. I do want to say that as I go to the first slide, please, we are seeing an increasing trend right now, and I'll talk about this slide in just a sec. We're seeing some outbreaks and virus activity in essential businesses. So our attention to date has been a lot on long-term care facilities, homeless, and then the hospitals, and really work with the healthcare system. And now, as we see the opening up a little bit of more essential work and businesses, we actually in the past week have noted a couple of outbreaks. And you've seen it nationally. I'll use the pork plants as an example. We're trying to get an early warning on that so that we can help business right away. But I wanted to note that for all of you because I need your help as we go forward and working together so that we don't have the situations occurring now in other states. So this slide right here is from the Institute of Disease Medicine. It is an organization that has been a key partner and help for both Public Health Seattle County and the state. You can see from the curve that we've been successful, as John said about flattening the curve. We prevented a much larger peak in late March and early April. And since then, we've been seeing a flattening. I would love to tell you we're seeing a decline in cases, but to tell you the truth, it varies around 100 cases a day, sometimes a little bit higher, sometimes a little bit lower. That ability to get it continue to go down is really important. And that's one of the challenges as we look to how we're going to open the economy. At the right side of the chart, you can see three lines diverging. One is going up, one's going straight, and one is going down. The line going up is a model of what happens if we, just like a light switch, removed social distancing measures. Even though slowed transmission, most people in our area remain vulnerable to infection. We think that there's only been around 50 to 70,000 people that have experienced the infection. 80% of people have light symptoms, but our goal is to make sure we don't have surge of infection. We would expect these to come roaring back if, as a light switch, we open the economy as people returned in close contact. That's why this conversation is so important to talk about the role that businesses can take as they think about how to open and how to protect their employees and their workers. The line going down models if we continued our current stay-at-home distancing measures for longer periods of time, assuming that people continue to follow them very strictly. And we know that's already not happening. Last Saturday or Sunday, it was very nice on Alki, and I saw a challenge for people trying to maintain social distancing. And this weekend's going to be really nice, so I encourage all of us to model great physical distancing this weekend as we want to get out in the sunshine. The line going straight is somewhere in between with a continued slow decline of cases, and that's really what we're trying to hit right now, because we can't ever expect that lower trend line to be in concert with us opening the economy. So with public health and partnering with you, we're trying to hit that middle mark. So if you'll change to the next slide. So this is from Governor Inslee's dashboard that he has put up. And these are measures that we're looking to. So it's about the risk to vulnerable populations, the activity of the disease, the healthcare system, what's called readiness, but really that's about their capacity to handle surges, testing capacity and availability, and case and contact investigation. Each of these are key to a success. One of the things we're doing here in King County is we will be taking these dials and turning them into target measures that we can share with you all and with the public so that the public is aware. Are we on track? When will we have to rethink? Because it's going to be awfully hard to turn the dial back when we open it up. Let me point out a couple of these so I'm not going over my time. I want to talk about the testing and capacity and availability. The dial for the governor, of course, is a statewide note, and we know that testing is starting to become more available, but I got to say this is an extreme pain point in King County. We have been requesting 20 to 30,000 test kits per week, and we've been receiving maybe 5,000. So even though the state is saying that we are almost at high risk, I would put that dial even higher, because we know that there's such an interest in knowing and being able to track new cases. And I'm hoping that will open up and get better, but that is one I wanted to point out. The second one is case and contact investigation, and this is one we want to partner with business on. How quickly can we scale up a workforce and partnerships to rapidly contact every positive case and their close contact? This is something that you're going to hear more about because as business reopen, the role of employers in partnership to look at preventing cases happening at the workplace, but we know there are going to be, and what are your practices when you find out you have an employee that is positive for COVID, encouraging them to be home for the appropriate period of time, helping us with who were exposures to that person. There's a great partnership opportunity here. Our executive and mayor are working closely with the governor's office in reviewing these measures. And for many reasons, as I said, Seattle County will be the critical element, how well our state manages this, since we're 30% and even more than that of the state's economy. Your leadership in responding to this challenge is key, and I so appreciate what we've done together so far and look forward to the future. Before I turn it over to Governor Gregoire, I want to just really greatly appreciate and acknowledge the amazing work of Challenge Seattle. They are taking our public health recommendations and guidance and translating them into concrete and specific how-tos for you. I just get delighted to be on calls with them. They're working directly with our health officer, Dr. Duchin. It's setting a model that our entire country should be watching and learning from and using, and it's just essential to our work, and I'm just grateful. So with that, I'll turn it over to you, Governor Gregoire.
Thanks a lot.
Great.
Patty, for those comments and your leadership through all of this. And we will turn to Governor Gregoire. And I just want to set this up and offer a little context to your leadership over the last several weeks, Governor, and just thank you for it and echo Patty's comments. Really incredibly appreciative of the convening role and leadership role you've played between the public and private sector, and that you've opened up the Challenge Seattle calls to organizations like the Downtown Seattle Association, among a number of other employers across the region. It's been so pivotal that we are all operating off of the same information from our state government, local government leaders, and that you have brought in. And you have taken the lead with the Washington Roundtable over the last several weeks in developing a checklist that businesses can use to support reopening. And I want to ask you, why did you do that? And what is it? And then how do you intend people use it? And we will share this checklist and the work that was produced by the Boston Consulting Group under the guidance of Challenge Seattle and the Washington Roundtable following the webinar. But I want to ask you sort of, when did you come to the conclusion that we needed this? Why did you put it together? And how do you hope employers of all sizes make use of it over the next several weeks and months as we look to reopen?
Great. Thank you. Thank you, John. And thanks to you and your whole team for being a tremendous partner. And Patty, I can't thank you, Dr. Duchin, the whole team at King County Public Health and the office for all that you have done. We're getting national recognition for the partnership that has resulted in what success we've been able to achieve to date. But it is a model of public-private partnership, DSA, public health, everybody working together to stop the spread. So a little bit about how we began. We began many weeks ago now, believing that at some point we were going to be able to reopen our businesses, and that if we didn't work in concert and if we didn't rely on real science, real data, real experts, we would not open in a way that would allow us to continue to see the lack of spread of the virus. So the Roundtable and Challenge Seattle asked for the help of Boston Consulting, but unlike how we normally do it, we set up a committee comprised of John Kelly from Starbucks and folks from Microsoft because of the experience that they've had in China and elsewhere around the world. Boeing because of the experience it's had here locally. Individual who works for the World Health Organization and was previously CEO of PATH. David Schumacher, who's the head of the Office of Financial Management for the governor, to make sure we were working absolutely in concert with the governor's office, because we wanted to make sure that we were taking the experience that BCG brought to the table with offices around the world, as well as offices around the US, but the real experience of our own employers. But importantly, we want to look through the lens of public health in setting up a checklist, if you will, for employers to reopen. So we work directly with Secretary Weissman at the Department of Health. As Patty mentioned, we've been working directly with Dr. Duchin. We've been working with the Hutch and what they've been doing early on in modeling, and the same is true with the UW. And so we knew that whatever we recommended, it had to be done with public safety front and center, because if we failed, we would find ourselves back to where we are, and wanted to make sure that reopening was successful along the way. So it's been a couple of weeks now ago, we issued our checklist. It's really what we call it is baseline recommendations. We have additional considerations depending upon the nature of the business, how large the business is, for things that can be done beyond. We're really recommending that every employer have a plan, that it's communicated well with every employee to build employee confidence, and that in some shape or form it's communicated with the public to build public confidence. Because if we're going to get out of what appears to be a recession, if not worse, we've got to have consumer confidence, particularly in downtown Seattle. The governor's Safe Start plan that was issued this past Monday cites the work that was done as a great start. We didn't see this as the be all and end all because obviously every employer is potentially different, size, nature, so on. So we wanted everybody to have a baseline checklist, and from that they could tailor it to their own work site. So we wanted to make sure that every employer in the region had a head start at getting the plans in place so that when the governor announced we might phase in a certain sector, our employers were ready to go, their employees knew they were, and the public knew they were as well. So in the document, we also talk about some very sensitive issues. Patty just mentioned one. It is an absolute partnership in contact tracing. So employers really can help making sure that when that investigator comes, if someone is tested positive at the work site, what exactly they can offer by way of information that may allow that investigation to move on smoother and faster rather than harming the continued operation of that work site. The second area is a very technical legal area, but one that we all should be aware of. And that is as we bring employees back to the work site, they may be, as CDC defines, in the vulnerable category or high risk, meaning those over the age of 60 and those with underlying health conditions. Those need particular attention and a real way in which to handle, so we've given guidance on that. And fundamentally what we're talking about is how do we instill confidence? Confidence in everybody at the work site that the employer is ensuring their personal safety, and confidence in those who visit that safety is paramount and that the employer is doing everything possible to ensure it. Let me conclude by saying we're going into a new normal phase. I think Patty said it well. It isn't going to be quick and done. It's going to be with us for some time. Getting a vaccination that will be worldwide is going to take time for us. So as we look at this new normal phase, it isn't really an issue that's up to government. It isn't really up to the private sector. Rather, interestingly enough, it's up to each and every person who lives in Seattle, King County, and the state to act individually and collectively to protect themselves and to respect and understand they have to protect their fellow human being. Whether it's out in play, whether it's at a work site, whatever it is, everybody has to accept their own particular responsibility. I think we're going to have a chore here of fighting complacency. Patty mentions it when it comes to weather. We can expect more waves. And so what we've done in our checklist is given up the information of have a phase 2. If in fact we hit a wave, what more can you do to make sure that wave doesn't result in another order to stay home, but rather a wave that we can weather through? It may not happen this summer. It likely will happen this fall, and it may be more than one wave. So we need to fight complacency, remain steadfast to ensure that we stop the spread and make sure that the dial of opening doesn't go back. That, in my opinion, is up to all of us in a true public-private partnership. And you, John, and your team have been a wonderful partner. John Kelly and Kevin and the team at Starbucks has been an unbelievable leader. That kind of partnership is what makes it possible for us to show the rest of the country we got the beginning right. We're going to get the phase in right as well. Thanks, John.
Thank you, Governor. And just a quick follow-up question. You took a lot of input from other employers and organizations in the development of the checklist. It wasn't something that was just developed in a back room and sort of sprung on people. You were really conscious about socializing it. And I wondered if you might just share some of what you heard as far as what that input was to the earlier drafts from employers and speak to maybe how it evolved over the last several weeks.
Yeah, we did solicit input, and I think it was ultimately very helpful in the outcome because people were saying, well, what about, you need to really think about the small employer. What about the nonprofit? What about government? So the tools that we've provided are meant to be for employers, business, nonprofit, government, whoever is the employer. And we also wanted to make sure it was tailored for that small business. Now, we did get some feedback. This will be challenging for small business. I really respect that. I get it. I understand it. But the consequences of us not being steadfast in every size of employer are too grave for us, so that we have to go all out. Now, we have turned our attention, John, to this idea of personal protective equipment that might be required of an employer, whether it's masks or temperature taking or what have you. And we're now working with the rest of the business community to see if we can't find ways to secure that at a very affordable price and make sure it's readily available to everybody. That's part of building the confidence. But we're particularly concerned about small businesses not getting access to it or not getting access to it at an affordable price. So this is our phase right now. We're in trying to help business.
Thank you for that. And again, thank you for the work and the immense amount of work that went into developing that checklist. Again, we will share it out to all of the attendees of this Access event today. And I think you will see how comprehensive in nature it is, how thoughtful and detailed it is. And we hope it is something that will be used by employers of all shapes and sizes as we collectively work to reopen. I want to turn now to John Kelly, and you've got some experience, John, in what we're talking about in reopening operations in China, where you've got more than 4,000 stores and 58,000 partners. Worldwide, 32,000 stores across 82 markets and more than 400,000 partners. I want to ask you if you can summarize some of the lessons learned from reopening in China and the approach you took there. And then you've made some announcements this week about your thinking around reopening in the US. Can you talk about each of those three areas and help us understand the lessons you learned there and how you might apply them here and how others can learn from Starbucks?
Sure. Good morning, and thank you, John. And thank you. I never want to follow Chris Gregoire. That is not an easy thing to do. So I will do my best, and I'll be brief because I know there's probably a lot of discussion to be had. Yeah, we've had, if there isn't an advantage in any of this, we're in week 16 of dealing with COVID-19, starting in Wuhan. And so we have had a bit of an advantage given our global footprint to both test and learn and adapt. In China, where now 95% of our stores are now reopened. In China, so many differences in terms of retail presence and engagement with local and national government. But we did manage to learn a lot. And some of those lessons, many of those lessons, we then are adapting to different cultures. I will tell you that from the outset, we don't see this just as a public health crisis. It obviously began as a public health crisis. But what we're dealing with now is both a converging economic crisis. And if you look at food banks, mental health, we have a humanitarian crisis in the United States that is emerging. And so if you are a small business or a large business in retail, this is absolutely a combination of all three that we have to figure out a way to address. And John, your earlier comments about where we are here in Seattle, I completely agree. I don't think there's another market in the world, and again, we are everywhere, but there are a few places better situated between our cooperation with government, our health academic expertise at the Hutch and the UW and the Gates Foundation. We have so many assets right here between our entrepreneurs and our innovators. If any place is going to get it right, it's right here in Seattle. And so we're proud to partner with DSA, Challenge Seattle, and the county to try to get this right. In terms of lessons that we learned, we established three principles from China that we adopted here in the United States. And those three principles have helped us decide virtually everything from the operational small decisions to the broader decisions about how we take care of our partners. And obviously the first print, and these are fairly universal and I probably widely shared among people on this call. First and foremost, taking care of our partners and our customers and their health and safety, number one. Number two, working with the county, with the state, with the CDC to help them contain the virus. And then third, continuing to find ways to serve our communities, especially now that things have gotten so much worse for so many vulnerable populations, and with 33.5 million people now suddenly unemployed. So those are the three principles that have guided all of our decisions. And we also recognized early on that there are kind of three phases to this. And they're accepting the reality of the behavior of a virus. You know, the first phase, which we all experienced, was sort of the contain and mitigate. This was the emergency phase of shutting things down. In China, we shut down 80% of our stores at one point. In the United States, more than 50% of our stores, because we were able to make our drive-through stores continue to operate. But the big decision we made on March 21st was to close our cafes. Even though we were allowed to operate as an essential employer, because we are a convenient food alternative, and governments around the world want to make sure that convenient food is still available. So while a latte is obviously not essential, you know, so many of the food and beverage offerings that we have are part of that. So by maintaining our drive-throughs, we were able to maintain our supply chain and some normalcy. We also, you know, for the partners who couldn't work and whose stores were closed, we ended up paying them. We were paying them whether they were working or not, whether they were healthy or not, for more than 40 days. And so we did catastrophe pay and service pay. And that was our big bet during the height of the crisis, to close our cafes, because we could not control social distancing. You didn't have what you have today of people recognizing 6 feet separation, facial coverings, and the things that are becoming more and more normal. And so by closing those cafes, that was obviously an enormous business impact, which we've been reporting. And this week, as you referenced, is a big week for us, because we are now reopening 85% of our stores across the United States and offering what we call modified operations. And that could mean a entryway contactless service. It could be delivery, mobile order and pay, but those cafes are still closed for seating. And we've taken the time, learning from China and from that first phase around mid-March, to adopt extraordinary protocols that frankly we try to exceed all health standards and expectations, whether it's sanitation, plexiglass, facial covering, airflow, in all of our stores. And that has taken us quite a long time to be able to develop those plans, design the stores, modify those operations, and mostly train our partners to protect themselves and to protect our customers. And so this is a very big week for us, where thousands of stores are gradually reopening in different ways and different formats. And our hope, and particularly for those on this call, our hope is that many of the lessons that we've learned and the protocols that we've put in place, many of which are reflected in the checklist that Chris referenced, we hope that this can serve as a model for small businesses. Obviously, we're a very large business, but every store is a small business for us. And we hope that, and we want to share with that. Particularly one tool that we've developed that we hope can be helpful is our own dashboard. And an element of the dashboard called the COVID Community Information Exchange. And this is essentially almost a Wikipedia page that is crowdsourced information about the status of local regulation on public health matters and opening, closing, and modified status. And so this is around the country where we are fielding data and incorporating data on a daily basis to find out what is going on in every county in the country. It's imperfect. It is not a source of truth necessarily, but it is in a very imperfect, data deficient crisis. It is better than nothing, and we hope it is something that can help employers large and small to have access to a publicly facing tool that just went live this week as well. So hopefully you all have information about that already and circulated. We'd love feedback on it. We hope it's of use to you. Finally, let me just say sort of the equation that we've come up with for every store as they face the choice to not only open, but how to open, is first asking ourselves, can we open? In other words, are the regulations in place, and can we abide by the regulations? And is the public health crisis in a state where we are permitted to open and operate? For the most part, that that in different venues that tends to be affirmative in the sense of we recognize that we have to adapt, and that's the phase that we're in right now. Is what we call adapt, basically adapt to a phase where the virus is going to come and go. This is not going to be clear anytime soon, as has been referenced. So we think that this adaptation phase is an important concept to understand, that just like in China, we may have to close one day. We may have 1 hour notice to close. We may be able to open 14 days later. That is the reality for all businesses, large and small, is getting into that adaptation phase and having protocols in place to do that quickly. And so we ask ourselves how, we ask ourselves, can we open? Do we have the labor? Do we have the supplies? And then we finally ask, should we? And that question is answered by, can we exceed, not just meet, but can we exceed the public health expectations of our local, state, and federal guidelines? So let me leave it there, and just thank you again. The partnership here in Seattle with the DSA and Challenge Seattle and the county is how we all get through this. We are far from over, and we are experimenting every day and learning every day, and we are hoping that we can be a resource to you all and anybody on the line, and we need to learn from you as well. So thank you for the opportunity.
Well, thank you, John. And you all absolutely have been an incredible resource. And I think we all benefit from understanding your thinking and approach, and very thoughtful approach you've taken both in China and how you're preparing for your US reopening. And we will continue to learn from that and share it out so others can benefit as well. You mentioned the three aspects of this huge challenge of the economic, the health, and the humanitarian. And in my introduction of you, I failed to acknowledge your role in leading social impact for Starbucks, and wanted to get that in there. And also ask you to talk about the work that the company's done over the last several weeks to respond to the humanitarian and community impacts from the virus and its effect on the economy.
Well, I appreciate that. I mean, that's my favorite question. Obviously, for our Starbucks partners, there are 400,000 of them around the world. One of the reasons they're at Starbucks is a belief in trying to be a part of every community that we serve. And so, particularly in the United States, we decided early on to do what we could to support our first responders. And so some of those Starbucks that remained open were hospital Starbucks or near a hospital. We've ended up serving more than 1 million cups of coffee. It's a lot more now to first responders for free at a critical time. And that's, again, something that is near and dear to our Starbucks partners. We've have a history of working on hunger relief. And so with Feeding America and the crisis that we're in there, both with food bank staffing and supply and infrastructure, that has been a top priority for us, both here in Seattle and around the country. And then third, I'll tell you that mental health, we were fortunate that we started 6 months ago to develop a new benefit for our partners on a very comprehensive mental health benefit. And we think that this increasingly is going to be a challenge as society gets through this. There are a lot of resources out there, and happy to talk more about that with your members.
Terrific. Thanks so much. I want to open it up shortly here to questions from attendees, and as you get yourselves organized and raise your hands, I'll put just a quick follow-up question to Patty. The contact tracing and the testing and rapid testing are key pillars in all of this, Patty. And do you have a sense of sort of where are we today versus where you think we need to be, and what's the best case for how quickly we get there in those two areas?
Yeah, that's a great question. Thank you, John. So right now we are actually partnering with the state on the establishment of the state contact tracing model. They're doing a training of a huge number of people. Here in King County, we're lucky that we have a lot of expertise in contact tracing, but we know that as the economy opens up, one of the most important pieces is going to be when we are notified that there's a positive test, to be able to contact that individual, get who get information about their household and also where they've been. And then if they have trouble isolating themselves, which this is a key piece, I think, for businesses to think about too. If that person is living in a household where there might be an elder parent, there might be multiple families living together, that we need to work together to figure out how to make a safe place for that person and also protect their basic needs. So there's a big learning there that we have to do together. In terms of the number of contact tracers we need, we're building a model based upon using technology as well as live contacts with folks. We're finding that different populations respond to different things, so that's an important learning. In terms of testing kits, I got one question already on that. The testing kits, I wish the state keeps getting promised they're going to have 1 million testing kits show up in their warehouse, but the date of those keeps sliding. So we're aggressively trying to find that. Some of the hospitals are doing some bulk purchasing. Your members will also hear a lot about antibody testing. And we are one of the areas in the country that's doing some science and experiments on antibody testing. The caution I give to everybody, because it's a lot in the media right now, is that what we don't know about the coronavirus is what it means if somebody does have a positive antibody test. There are hints coming out of New York that people, even if they had a positive antibody, they come back to their healthcare provider with coronavirus again. We know that these viruses mutate, so we would like to have an antibody test because that's really the way, particularly for businesses, to know how safe your workers are. If public health can guarantee you there's a relationship there. So this is a very complex subject. I appreciate the question.
Thank you. And now we'd like to take some questions live. And if you can raise your hand by clicking on the participant button at the bottom and then the raise your hand button on the screen. Emily can unmute you and you'll unmute yourself, and I'd like to ask you to identify yourself and who your question is directed to among our panel.
We have one question from Stephen Lavelle. Stephen, go ahead and unmute yourself.
Good morning. Thank you. This has been a very helpful webinar. I had a question about contact tracing, and is the state or the county or even the city working on some sort of technology like a phone app and that kind of thing? And will it be more of a statewide or more of a more local type tracing approach? Thank you.
Sure, thank you for that question. So there's lots of technology potential in this area, and we're exploring actually multiple things. And because King County is so diverse, as we know, some technologies work more broadly, and for some communities that are harder to reach or they have language barriers, there are challenges. So there's technology that the state is exploring that can be used on a phone app and allows individuals to report monitoring their own health. That's a more sophisticated piece of monitoring that has to be connected with the state database. In county right now, we're actually in discussions around piloting something. But we're also testing right now, real time, more level technologies that are already out in the public for how to get a hold of folks and check in on a basis, or if folks are having trouble isolating, doing that. So I think what you'll see emerge is multiple ways of doing contact tracing, so that we don't make it so complicated or have to miss a whole population because of our expectations. So we're piloting that lifetime here.
Thank you.
Thanks for the question, Stephen.
We don't have any other live questions. We don't have any other live questions. We don't have any other. Oh, there's one. Serene Chen. Serene, go ahead and unmute yourself.
Good morning. Thank you for the webinar. It was really, really interesting and great to just hear from you live as opposed to just reading all the guidance all the time. I had a question because our offices are based in downtown, and we know a significant percentage of our folks use public transportation to commute. And one of our considerations as we've been thinking about whether or not we reopen and how, or just the office, because our folks are working from home just fine, is the availability of mass transit and when that's likely to scale up again, because obviously we don't want to open our office if employees taking mass transit opens them up to more risk, because of that. So I don't know if there's any additional visibility that you guys have of mass transit availability and what those plans are. I haven't seen anything or much in the public guidance yet.
Well, this is Patty, and what I can say is that we're working with Metro on what we need to do to have riders and the Metro drivers be safe in this time. And so there is some retrofitting happening real time for Metro. I think that what will happen in a Metro plan, which I think is a great question and probably a webinar for the future, but I think we'll see in Metro is as we slowly reopen businesses, they're going to look at the demand and their schedules. One of the things that we'll be challenged with in mass transit is going to be social distancing, and how do we make sure that that's happening, as well as whether or not within those confined spaces we're going to be requiring masks. And what does that culturally mean to riders, et cetera? So there's lots of questions that are being sorted through right now, which as go through these governor phases of reopening, I think each phase will allow businesses to take a look at who are in that phase and what the need and interact with Metro.
And Serene, we'll have King County Executive Dow Constantine join us next Wednesday for a virtual roundtable and be putting some of those questions to him around the transit system and how we look to manage it safely going forward. Well, thank you for the question. Are there any additional live questions?
There are. Chris Sparrows, go ahead and unmute yourself.
Thank you very much, and appreciate this webinar and the dialogue. My question, I think, is focused to Patty, and I'd like to understand if there's any additional insight with regard to antibody testing and its specific the application of it to understand specifically related to the SARS-CoV-2 infection as opposed to the broader COVID family. My understanding is that antibodies may not be that specific. And so then reliance on them may not necessarily provide the insight that we're looking for the specific pandemic. And I'm wondering if you can comment on that. Thank you.
What a great job you did outlining the dilemma that scientists are having. So you're obviously well read up on what's going on with this. So I think that the key points here, as you said, coronavirus is a family. And COVID-19 happens to be, or as you said, the SARS-2 is particularly deadly compared to some of the other coronaviruses. And the problem is with the sensitivity antibody tests. So there's just so much work around the globe on this, trying to see if they can figure that out. And also what it means if you have a positive antibody and how long that really holds protection. So it's not just about it's for COVID, but it's experimenting and learning about this particular virus. And one of the challenges I think you're going to see more in the media is that these viruses are not stagnant. They change, they get in the environment, and they mutate. And scientists are also trying right now to figure out, is the mutation going to make them more deadly? How do we develop this antibody test with all of these what we'll call generations of viruses? So, it's a whole science of itself. I have great admiration for the folks doing it.
Thank you for the question, Chris. And there's a question in the chat box for John Kelly, just about further regarding your experience in China and whether you had to, after you reopened stores, whether you had to also then close them as you saw or potentially experienced flare-ups in the virus spreading. Did you have that experience in China, John, and are there things to learn from it?
Thanks for the question. I think this is a really, really important point that we need to have a lot more public conversation about, which it is the nature of a virus that it comes back. Until there is a vaccine or any other viable treatment, it will come back. We can do everything right and it will come back and it will be with us. And so the answer is yes. We had to close stores, and we close stores every week. If the virus comes back and health officials come and say there's a cluster or an outbreak, or if we report an exposure of some kind. So absolutely, that's what we mean by adapt. This is an adaptation phase until there's a vaccine that's viable, scalable, and safe. This is going to be a give and take kind of thing. So the answer is yes, we absolutely are doing that in China. The good news is 95% of our stores are open, but we have to adjust and adapt, and we assume that we're going to be doing the same thing in the United States.
Great, appreciate those lessons from your experience there. Emily, are there additional live questions to take?
There's a question here from Josh LaBelle. Josh, go ahead and unmute yourself.
Hi, thank you guys very, very much for taking the time. I work in the performing arts, running 3 historic venues, 2 of which are in downtown, the Paramount and the Moore Theaters. And I guess I'm going to cut to the chase. Feel like our businesses, our sector in the performing arts, running large gathering spaces, may be pretty severely impacted in terms of staying closed for a very long time. Should we be planning on staying closed until either physical distancing is lifted or there's a vaccine?
That's probably a question for you, Patty, on sort of large events and our great performance venues and how they should be thinking of their next several months in the future.
Yeah, so I'm a big fan of performing arts, and my heart just is so sad about the impact to all the arts. So right now, large events don't get reinstated until later in phase 4. But one of the challenges with a vaccine, somebody asked me, answering on the chat box, that it's really unpredictable when or if ever a vaccine will be found. I mean, there's a lot of hopeful things happening right now, but what doesn't get put in media for those these specialists, communicable disease specialists, is that vaccine trials often find that the adverse effects of vaccine cause it to not be as effective. And so there's a lot of work to be done to find a vaccine. I was Admiral Bono, who is the governor's designee to work with the health system and long-term care, said yesterday that when she joined the Navy 30 years ago, the vaccine for malaria was just right around the corner. And when she retired 30 years later, it was still being said it's just right around the corner. So I mean to paint that dark a picture, but it's just really unknown. So I think the social distancing and measures that can be done and creative ways of doing the arts right now, all of that is part of our new reality we need to put together so that we can get back to what we know everybody needs in their life.
Thank you.
We have another question from Sandy Lou Haler.
Morning, Sandy.
Morning, and thank you, all four of you. I'm awestruck by what you all are doing and so appreciative. I'm just a little teeny business, and so I have a kind of a small question. I was recently at my bank where they kind of make you come in one at a time, and they ask you questions before you enter. You know, do you have a fever? Have you been around anybody? Are you sick yourself? And I wonder, when in the future, maybe in phase 2 or a little later, I open my business, is this appropriate, or does it do any good? Is it, is that a gateway thing that one should do?
This is Patty again. So these type of strategies are core to some of the conversations we're having with Challenge Seattle, because screening of this type has been shown in other countries to be very important and effective. And so I think you'll see more information on that coming out as we go through the different phases.
Okay, John, can I make a suggestion here?
Please do, Governor.
So Sandy, what we put in our checklist, as Patty's referring to, is that employers have a lot of decisions to make as to how they will ensure the work site is safe for employees as well as others. And so some of the methodologies that you need to consider are, one, do you have at minimum a self-certification by an employee upon arrival at the work site? In other words, the person says, I have no symptoms, I took my temperature, I did whatever, so that there's at least something minimal that you're ensuring that the persons who arrive there are actually safe. The other kinds of things that we have suggested are whether, for particularly larger employers, should they have infrared temperature taking. A lot of that, I think, John, goes on in China. And so that's one of the other issues we've asked about. Again, in terms of acquisition of that, we're looking around the globe now to see if we could resource that to employers who choose to use that. But again, these are the kinds of things we've asked every employer to think about, but at minimum, asking the fundamental question, are you self-certifying, and obviously defining for the employee what that means upon arrival at the work site, that so far as you know, you do not have a temperature, you're feeling good, that you have no symptoms before they're allowed to proceed at the work site. So again, it's tailored for every work site, but at minimum, that's what we recommend.
Thank you for that, Governor. And thank you for the question, Sandy. I want to be mindful of everyone's time and wrap up by just thanking our panelists, John Kelly, Patty Hayes, Governor Gregoire, for joining us today, but more importantly, for all of your incredible leadership over the last several months. Our values in Seattle have always been about collaboration, resiliency, innovation, and compassion for others. They've been on display over the last 2 months as we flatten the curve collectively between the public health leadership and the private sector leadership and all of our individual actions. And those values are going to be absolutely necessary as we work to rebuild our economy together, reopen small business, offices, our arts and cultural community, and get our economy and our community back on its feet. So thank you all for joining us. I wish all of the mothers out there on the call today, happy Mother's Day weekend. Enjoy the sunshine, but stay 6 feet away from each other. And my wife, the dermatologist, would say, put on your sunscreen. So thank you everybody for joining us.
Thank you.
See you next week, we hope, for our next virtual access event. Take care.
Thank you.
Thank you, John.
Thank you.